Class is now starting. All attendees are in listen-only mode.
I assume we should probably give everybody like a minute or two and then we can proceed.
I'll go off camera now.
Hi, everybody. Thanks for being here. We'll give everyone just a minute to get logged on and set up before we get started.
Would you like me to disappear myself until you call me up? I can do that.
Yeah, I think so, Kath. I think so, Rebecca. That's what we've been doing. Well, you know, it's 8:31, so why don't I do a quick introduction, and then Odian, you can take over. It'll probably take a minute or two to get the folks still logging in. Hi, my name is Wakenda Tyler, for those of you out there, and I just want to take a quick word to thank all the presenters who have really dedicated some time and energy into putting this presentation together, so I'm really looking forward to it, and I hope you all are as well. I want to also make a shout out or make a note to the fact that Stryker is the sole company that's supporting these seminars, and we really appreciate their support on this, the financial support to put these into fruition. So on that note, I'm going to turn it over to Odian, who's going to introduce the speakers. And thank you, Odian, for running the show for this, and thank you, Tessa, very much for this.
Thank you, Wakanda. Good evening, everyone. It's my pleasure to introduce my co-moderator, myself, Tessa Balak, from University of Chicago, and I'm Odian Benite from Moffitt Cancer Center. Welcome to this webinar on the well-being for orthopedic oncologists, not the same old burnout talk. I'm just going to give a couple of introductory slides and then hand it off to the experts. These are our disclosures. And so I know we've all heard about burnout a lot, definitely over the past 2 to 3 years. Burnout is a work-related syndrome involving emotional exhaustion, depersonalization, and a sense of reduced personal accomplishment. When we look at the consequences of burnout, starting on the left-hand side of this chart, for the personal, it can lead to broken relationships, alcohol and substance use and abuse, depression, and even suicide. From the professional standpoint, their studies have shown decreased quality of care and increase in medical errors, decreased patient satisfaction, decreased productivity and professional effort, and increase in physician turnover. When you look at the data on which physicians are most burned out, you can see on the slide there, and it kind of highlighted oncology and orthopedics. So at 42% of oncologists reported burnout, orthopedists at 34%. So as orthopedic oncologists, we're probably around 42, or at least somewhere in between. So high numbers. If you look at the age of the patients, the highest reported was in Generation X, which is where I fall into, and a little bit lower for the millennials and the boomers. And this was from Medscape National Physician Burnout and Suicide Report 2020. And so our learning objectives are, one, to understand risk factors for physician burnout, depression, and suicide, recognize unhelpful thought patterns common to surgeons, and to describe tools and techniques to manage well-being. I'm going to hand it over to Tessa now.
Thanks, Odian. So it's my pleasure to introduce our 2 speakers for this evening, neither of whom are orthopedic surgeons, which will bring a fresh perspective to this whole topic. Our first speaker is going to be Rebecca Bernard, who's a family physician in Southwest Florida. She has authored 2 books, How to Be a Rockstar Doctor and Patients at Risk, and is going to share her thoughts with us. And then Dr. Candice Norcott, a clinical psychologist at the University of Chicago, will get into some of the actionable steps that you can take to help with burnout. She'll engage us in some activities that we can do on our own, and as part of that, she will ask for a bit of audience participation. During that time, feel free to use the chat function to share feedback with her and share some of the thoughts that you might have in response to her questions. Also, feel free to use the question box during tonight's webinar. We'll read questions largely at the end, but if there are some that seem appropriate for us to interrupt our speakers with, we'll do that too. So we look forward to hearing from both Rebecca and Candace and look forward to your participation. And I'll pass it. There we go, Dr. Bernard.
There we go. Thank you so much. Thank you for that kind introduction and the invitation to be with you. And I want to thank all of you for taking the time to log on. You know, I'm not unaware of the irony of having a burnout talk at the end of a busy day during your family time, during your free time. So I get that, and I have total empathy for that. So we're going to be very respectful of your time and be very focused on tools and techniques that you can learn to improve your wellness. As you heard, I'm not an orthopedic surgeon or an oncologist. I'm a family physician. However, I got really interested in physician burnout a few years ago when I lost a colleague to suicide. And it really rocked me and my entire community because we had no idea that he was suffering to this degree. And we've lost other physicians to this as well. And it's become something that we realize we have to talk about, and we need strategies to improve our well-being. So of course, we're talking about this because doctors are burned out and unhappy, and almost 50% of all physicians report making active plans to leave the practice of medicine. We see high rates of depression, especially among medical students and residents, and it's estimated that about 400 doctors per year take their own lives. When you ask doctors if you're happy, rather than are you burned out, just say, are you happy? It's not looking too good. Here you see that the happiest doctors are dermatologists, but as I like to say, if the dermatologists aren't happy, you know we have a problem, and we do. Dermatologists only report being 39% happy at work, 66% happy at home, and they're the happiest of all. The saddest doctors are the internal medicine doctors, only 24% happy at work and 53% happy at home. And orthopedic oncologists are probably somewhere in the middle. So definitely we can do better. When you ask doctors why they feel burned out, it's usually problems with our broken healthcare system, which involve a lot of bureaucratic tasks, paperwork, lots of hours, and sometimes doing things that we don't feel is necessarily helping our patients and makes us feel like we're just a cog in the wheel. But surgical oncologists have some extra challenges that you deal with, and that's because your patients are often very, very sick. You often lose patients through, of course, no fault of your own. These patients are quite ill, and you do have high rates of patients dying of their conditions. It's very challenging to take care of young children or young patients with life-threatening diagnoses. That leads us to a lot of existential thinking, meaning of life, and why bad things happen to good people, and that's really challenging. And then, of course, you guys are involved in many, many, many hour-long surgeries, and lots of things can go wrong, and sometimes things do go wrong, or sometimes even when you do everything right. So how do you cope with that, and how do you recover when something like that happens? We know that physicians are at higher risk for depression if they have certain characteristics. And unfortunately, in your specialty, you guys are at high risk for a lot of these, which is number one, dealing with death, as I mentioned. We know that when you are working 24 hours on, that is absolutely associated with depression, as well as lack of sleep, being more self-critical, making mistakes, which unfortunately is inevitable because we're all only human. And then also having difficult relationships with your coworkers and your patients. So these are things to keep in mind and ask yourself, you know, am I experiencing any of these risk factors? And if so, what can I do to change them? And also, we know COVID-19 has not done us any favors as far as burnout. Most doctors, this was back in May, were reporting an increase in their mental health strain. I haven't seen more recent data, but I can only imagine that it would be a little bit higher. So let's talk about what we can do to mitigate our risk factors. Number one of the very, very most important things that we can do is to get emotional support. And it sounds easy, but it's actually very challenging for physicians because we are trained in a certain way. Our medical training often encourages us to stay quiet, to be stoic, and to suck it up, as they say. A lot of times we're told to suck it up, don't express your emotions, and we're taught to compartmentalize to move on to the next patient. So you may tell one patient that they have a terminal illness and have to walk out of the room and into the next exam room and turn on a completely different face to the next patient and try not to think about what you were just saying and move on. And we can do that for a certain amount of time, but there's only, it's not something that we can sustain over the long haul. Of course, we're often very, very busy, so we don't take the time to process our emotions. And we may be afraid of consequences, like if we tell somebody how we're feeling, that maybe we'll be perceived in a negative way. And then we also may perceive ourselves in a negative way. In other words, if we reach out for help, that means that we couldn't do it ourselves, so we're weak or we're a failure or we're not perfect, which is hard. As physicians, a lot of us are definitely perfectionistic. So when we look for help, that is an indication that we're not perfect, and that can be hard for us to accept. But we must accept it. It's essential. And we need to get help from others. And the key to doing that is to acknowledge our emotions, and sometimes just even acknowledging it to ourselves. So whenever you're feeling particularly upset, sad, angry, anxious, then just taking a moment to acknowledge that feeling. And that may be as simple as writing it down, but also sharing it with others, especially our colleagues, because we certainly can understand one another how we're feeling. But also, don't be afraid to share with your family and your friends. A lot of times we hesitate to do that because we don't want to be a burden, but actually we're doing a disservice to our family and friends when we don't share with them, because we're not giving them the opportunity to help and to be of service to us. You also have to be sure to practice self-compassion and forgive yourself, because, I often think that we are much harder on ourselves than we would be on a colleague or on a patient or a family member. So we need to be kind to ourselves. And when we're self-criticizing, we should ask ourselves, is this how I would talk to a child or to my best friend? And try to talk to ourselves in a more compassionate way. And really having a low threshold for professional support, not being afraid to reach out for help, for resources, so that we can get past something difficult, especially if we've had a bad outcome. It's something that I think should be an automatic, almost like a debriefing. When a police officer is involved in a shooting, they almost always have to go through a psychological evaluation and a debriefing. And yet when we lose patients or someone dies, we don't do that. We just move on, and that's not healthy, and it's not the way we treat other professionals. So we need to have a low threshold for professional support. So as I mentioned, sharing emotions can be as easy as journaling, can be more detailed like therapy, and then something in the middle they call peer group processing. I think it's funny because the Mayo Clinic sponsored a study in which they gave residents some money and some time to go out and have dinner together once a month. And they found out that doctors that did that, they had dinner with their peers, had lower rates of burnout. So they called that peer group processing. And I call that just getting together with your friends. And of course, right now during COVID, it's really hard to do that, but it's important, and it lowers our burnout. So getting together with your colleagues, and keep in mind that when you're in your residency, it's a little easier to hang out with your friends. I mean, you're busy, of course, but you are around your colleagues. And when you get out into private practice, sometimes that becomes more difficult because there's no call central area where you get together, no meeting rooms. So you have to sometimes make an extra effort to be able to have that time together. I mentioned professional therapy, and one of the most important aspects that a psychologist can help us with is something called cognitive behavioral therapy, which is just a fancy way of saying that we can learn and train ourselves to think in a healthier or more positive way. So if I'm having a negative feeling, as an example, if I'm walking down the hallway of the hospital and I see a physician colleague and they see me and then they turn around and walk the other way. And immediately I think that person is angry at me. I did something that upset them. And now I start dwelling on that. What did I do? I start getting upset. Maybe I talk in a rude way to my office assistant because I'm upset, and basically it carries on throughout the day. Well, in the case like that, I might start by acknowledging my feelings. Well, I'm really upset by this. But then the next most important point is to identify your false or distorted thoughts. So in the case of the doctor that turned around, it's possible that they didn't see me. walking, or it's possible that they just remembered something that they had to do. So you have to identify that your thought isn't necessarily logical, challenge your belief. And then what's also can be difficult is practice cognitive reframing, which is deliberately choosing to think in a different and more positive way. So in that case, I would tell myself, most likely the doctor's not upset with me, they just didn't see me, or they had something else that came up. And I'm going to repeat that until I start to believe it. You don't always believe it the first couple times, but if you continue to tell yourself a more positive message, eventually it does start to resonate. You start to drill those new patterns into your brain cortex. And it works. Studies have shown that cognitive therapy helps improve wellness. It decreases depression. It decreases anxiety. It's effective for pain. There are lots and lots of areas. And another simple technique that we can use is the practice of mindfulness. Sometimes people kind of roll their eyes when they hear about this mindfulness. It sounds kind of touchy-feely, but the reality is that studies show that the practice of mindfulness does improve wellness. In one study, they had volunteers practice a guided meditation for 10 minutes twice a day, and functional MRI scans actually showed rewiring of their brain to more positive ways of thinking. And so in this picture here, the man's walking the dog and the man's thinking of everything. The dog's just looking at the trees and the sun. And so that's the idea of mindfulness, is just being aware of the moment, your feelings, and what's going on around you. So it could be something more elaborate like meditation, but it could be something as simple as just being focused on how you feel in the moment, something that's a simple pleasure, walking outside, but actually taking the time to look at your surroundings, or even just practicing a few deep conscious breaths. Maybe you even just do that in between exam rooms or in between surgeries. It doesn't have to be an entire meditation schedule. Another way is to think about things that you're grateful for. So gratitude training, the idea of just writing down 3 to 5 different things that you're happy about in your life, things that are good, and also imagining what your life would be like without those things for a moment can have a really beneficial effect on your well-being. There are lots of apps out there. Some of them are free for healthcare workers this year, and I have just listed some of them, and I know that Candace is going to go through a mindfulness exercise with us at the end of the session. A few other risk factors that we can work on. I mentioned that having 24-hour responsibility and not getting enough sleep can cause burnout and depression. So we need to make sure that we're not overworking and that we're not playing the martyr. I used to have an attending that would say, "Oh, you can sleep when you're dead." And that's not really a healthy way of thinking. Yes, of course we can push ourselves for a certain amount of time, but we're not superheroes. We are real human beings, and there's really only so much that we can do before we start to break down physically and emotionally. We also need to make sure that we're balancing the amount of time that we're in stressful situations. So we're rotating between more difficult clinical responsibilities and then maybe taking a break and something less difficult. It's important not to take on everything yourself. And I just started going too fast through there. I'm sorry about that. There we go. Don't be a perfectionist, which is really important, because you don't have to do everything perfect. And sometimes the perfectionism is really, they say, sometimes the enemy of good. Make sure to take care of yourself. And it sounds kind of crazy that we even would have to say this, but getting enough sleep, getting time for exercise, eating right, and taking care of our own medical needs. I mean, it's not a good idea to take care of your own physical health. That saying that the doctor who takes care of themselves has a fool for a patient. Well, it's really hard to be objective, and you also don't want to get care from your colleagues, or you can, of course, but studies show that you're not going to get the best treatment when you go that route. The best treatment is actually having a formal visit with your own personal doctor for your medical care. Make sure you take time to unplug. I know it sounds crazy, like how can I not take work home? I get it, but as much as possible, try to have a buffer between work and home. Your home should be your sanctuary, and you shouldn't have to be all night charting, and this is the time that you need to be spending with family and doing things for yourself. I'd say during COVID and during our political season, you want to avoid excessive exposure to news media. You might want to set a limit or a timer. I have one on my Facebook. It's for 30 minutes because I find I kind of get sucked down into a vortex with it. So you can set timers, you can turn off notifications, but trying to avoid that overload. And look to some hobbies, because medicine is a calling and it is a big part of our life, but really it shouldn't be everything in our life. We need to have something else outside of medicine. And so even just it's something that you might do once a month or every couple of months, any type of hobby is really good for our health. And don't feel guilty if you do something a little bit frivolous. If you binge watch a little bit of TV, you have to tell yourself sometimes it's okay just to unplug a little bit and just relax. So if you're going to do that, you're going to have to figure out where you're going to find the time. And the way to do that is to learn how to set boundaries. And that's very hard because physicians are people pleasers. We often want to say yes to everything. I struggle with this myself. So we have to learn how to set boundaries. And the way to do that is whenever you're asked to do something or there's additional responsibilities, then ask yourself why you're taking on those responsibilities. What are your motivations? And when you think about them, ask yourself if those activities are adding value to your life. So a chairperson asks you to sit on a new committee, and this physician wellness committee, let's say. And as they ask you, you're flattered, or you want to say yes just because this could be a stepping stone into a future opportunity, or you don't want to let down the person that's asking you. Consider all those things. Why would I agree to accept this position? What are my motivations? And then would that position, would that task add value to my life? And if the answer is yes, I could see that I think this will be really positive for me, then say yes. But if the answer is no, you think, gosh, it's probably just going to be more busy work. I think it's going to stress me out. Then you have to remember that no is a complete sentence and you don't need to over-explain. You can simply politely say no. And you may have to practice feeling okay when you say no, because it's not going to feel comfortable. So that means that just imagine yourself saying no and it goes well. That's part of an exercise you can do when you're working with a therapist on cognitive therapy. It's just practicing being okay with that. And part of setting boundaries can be also not taking your work home. So in just my last couple of minutes here, I want to talk about what you can do if you have a colleague or a trainee that you see that you're worried about. Sometimes when our colleagues do end up taking their lives, maybe we never saw it coming, but in other cases there may have been some warning signs, but perhaps we didn't know how to deal with it. So it's great if you can put experienced and inexperienced workers together in a buddy system so that someone's keeping an eye out for any warning signs. Warning signs include a change in a pattern of behavior. A doctor who was always on time for meetings is now late all the time, or they're always very well dressed and all of a sudden they're disheveled. Doctors that are withdrawing or isolating from others, don't seem to be excited about anything or having somatic complaints, pains, that can be a sign of depression. So the key to helping prevent suicidal actions is to get them help before they get to that cognitive distortion, that kind of point of no return. So we want to help them to be able to acknowledge and share their negative emotions and feelings before it boils over and gets extreme. So if you do have a gut feeling that something isn't right with a colleague, take action. You don't want to engage in what they call the conspiracy of silence, which is when a lot of people recognize something, but everyone was afraid to speak out, or they thought that someone else was going to do it. They call that bystander effect. Well, I didn't talk because I thought someone else would. And it's going to feel uncomfortable. And so we have to acknowledge that and say, this is going to be difficult, but it's important. So the next thing is just to find a good time, ideally when things aren't crazy busy, maybe at the end of the workday in a quiet time, and then just generally inquire, how are you doing? And they might say, oh, I'm fine. But say, well, no, really, I just wanted to really make sure you're okay because I felt like you were withdrawing a little bit. I haven't seen you. So just trying to dig a little bit deeper. And if they do start to open up, you want to use emotional mirroring and validation to help them. And what you do is you listen to words that they say to you and listening for feeling words. So maybe the doctor says, no, I'm fine. I'm just sick and tired of all this charting I have to do. It's just, I'm over it. So you heard them say that. So then you want to repeat back what they said or use a synonym. So you could say, so you're really sick of all this charting. It sounds like you feel like you're never going to get through it. And then you ask them, is that right? And they will either acknowledge it, yeah, I mean, I'm sick of this, or they might say, well, no, it's not really that, it's that our new computer system is blah, blah, blah. So then you would repeat back, so you're saying that the computer system is really burning you out. And so you just want to keep repeating until you get to the root of the feeling that the person is having. And then the next step is to validate their concerns. Now, you don't want to problem solve. So let's say they're telling you how much they hate the new computer, and you might say, oh, well, let me help you come up with some new templates, and I can show you some tricks. And so that's not our role in this case. You don't want to problem solve. You just want to listen, and you want to validate. So you would say to the person, wow, it sounds like you're really feeling overwhelmed, and I can understand why you would feel that way. I would feel that way too, and it's really tough. So you just want to validate their feelings. And then if the physician starts to open up and talk and share their feelings a little bit, then, maybe very gently just say, it is tough what you're going through, and I really feel that this is hard, and I know it's hard for me too, and maybe we should think it would be good for you to talk to a professional about how you can cope with these feelings. And doctors often respond well to telling them, your patients need you, and so if you don't take care of yourself, you're not going to be there for them. And the more you take care of yourself, the better you're going to be for patients. So, oops, I don't know what just happened. And then you can find hopefully a psychologist or a physician coach. Maybe your community has one, your medical society. I'm not sure what happened. I'm so sorry, you guys, if I've messed up anything here. There it goes. And then there is a physician support line that is free and confidential for physicians that is staffed by psychiatrists. And so you can get that information. They have a website, but also this phone number. So don't be afraid to call for help. And then this is my contact information if you ever would like to reach out, and I'm happy to talk with you and look forward to taking questions at the end.
Wonderful, thanks. And with that, we'll pass it to Dr. Norcott.
Hi, everyone. That was great, Rebecca. Thank you. So for my part of the talk, it's going to be a bit interactive. So if you have the ability, when you're invited to put some of your thoughts into the questions, or you can just grab a piece of paper and take some notes to yourself when I invite you, and I'll step out on a little faith that these are some things that you're allowing yourself to engage in. So we'll try it that way. So I'm going to be, running us through some tools for well-being. And in a lot of ways, I think that interventions are often, I think of those cartoons when the cartoon character gets in line and then they get back in line, but they have a big nose, and then they get back in line and they have a mustache. Like, a lot of times we're hitting the same themes in different ways. And I think what you'll find is, as I talk, I hit a lot of familiar themes, as what you just heard from Rebecca, but there's a lot of ways in. So there may be ways in which you hear them again for the second time, or you hear the way in which I talk about them that makes it more or less alive for you. And that's okay, whichever way kind of resonates more with you. So this is the way that, I've talked to the residents that I work with at the University of Chicago. I'm the director of GME Wellbeing. And so I've been working a lot in collaboration with the physicians and the resident physicians there. And as you know, the wellness of residents and the well-being of residents is really linked to the well-being of physicians and their attendings. So there's a lot of parallel process going on. So let me see if my advancing works. Well, I'm trying to go forward on my, okay, there we go. So I don't have anything to disclose. And my colleague at ACGME, Dr. Slavin, I was in a conversation with him, and he often talks about environmental illness and issues of mindset being our dual challenge. And Rebecca talked a little bit about our environmental illness, right? She kind of laid a really nice foundation for us. And it's really important to start with environmental illness, because if we don't name what's around us and what are the pressures around us, it can lead to blame and shame, when in fact it's the environment that's toxic, right? And so if we trend towards being critical of ourselves for not being well in a toxic environment, that's not very productive, right? And it can kind of take the wind out of our sails when we think about doing the things that we actually have to do to keep our ship steady in the storm. I'm going to use the ship metaphor quite a bit. And so while we name and acknowledge the environmental illness, what I want to talk through and think, take us a little bit deeper with are these issues of mindset and these other things that we can do that are within our control. And so when I say issues of mindset, Rebecca touched on these, but I used this graphic from psychologytools.com because I think it really highlights some of the most common unhelpful thinking styles. And I like to call it unhelpful thinking styles because I don't want to, again, like kind of staying away from the shame or the self-criticism, but it's more just saying, when this thought pops into my head, is it helpful or not? And so some of the most common ones, I'm not sure if you can read all the small lettering, so I'll just read out some of the common ones, are like emotional reasoning, right? So assuming that we feel a certain way and assuming that it's true just because we feel a certain way. So I'm embarrassed, so I must be an idiot. Shoulds or musts are things that come up a lot when I'm working with residents. I should do this, or I should be doing better, or they should be doing this to support me. And a bad therapist joke is, you're shoulding all over yourself, right? And what it does is it ends up making you feel critical of yourself or frustrated of other people for what they're not doing. And so really watching some of these more common thoughts and thinking, is this serving me? Is this thought helpful to me? And when I dwell on it, is it making me feel better? So I often cue people. And these thoughts, these things are within our control. And so then when we consider some of these things, right, considering the issues of mindset and the things that are within our control, we break these down into, I want to talk about them in 3 different ways. So 3 different access points: self-regulation, reframing, values, and committed action. And again, when we think about different doors to well-being, these are 3 different doors that you can go through. I work a lot at the beginning of the pandemic. Some of my colleagues at the hospital, we started a program, and these were often 3, we called them antibodies, that we would offer as ways to just inject yourself with a little well-being amidst the crisis that we're experiencing. So I've kind of adopted some of those that they created. So when we think about self-regulation, thinking about relaxing the body to relax the mind. You can't do anything or be effective in anything if your mind is in a panic. And you can't think your way out of anxiety, right? And so it's really crucial that we relax the body to relax the mind. And so just some types of self-regulation skills that I really feel are foundational are listed here on this slide. And so one I want to just invite us to do. And so I'm going to walk us through it. And then I'll kind of trust that you're experiencing the power of 4-7-8 breathing in your own home. So 4-7-8 breathing is based on the Hatha yoga technique, pranayama, and Dr. Andrew Weil talks about it a lot and kind of has brought it into mainstream teachings. You can see him give YouTube lectures on 4-7-8 breathing. And it's meant to do no more than twice a day. And you can do it even while you're lying down right before you go to bed. And it's actually really helpful for sleeping. So you're welcome, because if you accept the invitation and practice it with me now, you may have a better night's sleep for yourself tonight. So 4-7-8 breathing means that we're going to breathe in through our nose for a count of 4. We're going to hold for a count of 7. And then we're going to breathe out through pursed lips for a count of 8. It's not seconds, it's counts. And I'm going to do the first one, but then you can do the other 3 on your own, at your own pace. And we're only doing 4 breath cycles, okay? And you can either close your eyes or you can just soften your gaze if that feels safer. If it doesn't feel safe to close your eyes, just soften your gaze and maybe look at something on the floor in front of you. So again, I'm going to count us through the first cycle, and then you can do the last 3 on your own. Okay, so we're going to breathe in through our nose for 4. 1, 2, 3, 4. Hold for 7, 2, 3, 4, 5, 6, 7, and out for 8. 2, 3, 4, 5, 6, 7, 8. Okay, 3 more on your own. That's 4, 7, 8 breathing. And again, don't do it more than twice a day. It can be helpful with your sleep. And one of the main things about some of these self-regulation skills is that they're portable, right? You can do that anywhere. You can take a moment and do that absolutely anywhere. And for some of them, nobody even has to know you're doing them. Progressive muscle relaxation is another effective one. We don't have time to do it today, but there are many, many scripts that you can look at on the internet that you can find. I prefer progressive muscle relaxation audios with a British accent. I don't know, that's just me. I find it more relaxing. And then there's the 5 senses activity and dropping anchor. We're also going to try the 5 senses activity. So the 5 senses activity is an activity that roots us and grounds us in the present. Oftentimes we get really distressed thinking about the future and worrying about what's going to happen, anxiety. Or we are dwelling on what's already happened in the past. And that often manifests as depression or low mood, right? And so it's really imperative that we root ourselves in the point in time in which we have control, which is the here and now, the present. So we use a grounding technique like 5 senses. And again, this is something that you do in your imagination. Nobody has to know you're doing it, and it's portable. So I will invite you again to try this with me. So take a moment and just think about 5, notice around you and name to yourself 5 things you can see. So 5 things you can see. Now, how about 4 things you can touch? What about 3 things you can hear? How about 2 things you can smell? And 1 thing you can taste. Saliva counts. And oftentimes people feel that they can get rooted or they find themselves really connected to 1 sense, 1 or 2 senses. So by the time they get there, that's when they really feel that rooting and that grounding feeling. For a lot of people, it's hearing, because oftentimes we're just kind of moving around the day and we're not still. And that sense kind of causes us to kind of stay still and listen. For other people, it's touch, it's the physical touch. So now you have 2 tools that can help you, that's portable, and that can help you relax the body to relax the mind. Another activity is called dropping anchor. And again, stress on the portability. This is absolutely something you can do anywhere, and it's simple. You just kind of center yourself and connect with the world around you. We should be a little bit there already with the 5 senses activity. And plant your feet on the floor. So in your chairs, wherever you are, plant your feet on the floor. Maybe you're standing. Just kind of stand heavier on your feet. Push them down. Notice the floor beneath you, supporting you. Notice the muscle tension in your legs as you push your feet down. Notice your entire body and the feeling of gravity flowing from your head through your spine and legs into your feet, like you're wearing moon shoes. Now look around you and notice what you can see and hear. Notice where you are and what you're doing. Self-regulation. And Rebecca kind of cued us to the second way in, right? The second access point, which is reframing. When you're relaxed and when you're able to fully kind of use all parts of your executive functioning, all parts of your brain, you can think about reframing, right? You can think about what are the thoughts, what are the perspectives that aren't serving me right now? And at times, even our values, even too much loyalty to our values and ideals can trip us up. Outside stress can cause internal conflict, and we can have feelings of hopelessness or futility. And so when I think about when values and our ideals can work against us, I often think about these ideals, right? Selflessness, loyalty, stoicism. And like selflessness can be really good, right? And we often pride ourselves on selflessness. We place others' welfare first. And often that's why we went into the health profession. But we need to pay attention to when it then turns into not seeking help for ourselves. And just because you pay attention to that and you try to kind of create more balance doesn't mean that you're selfish. It means that you're staying in that functional place within that value or ideal, right? We want to make sure loyalty isn't turning into guilt or depression with loss. Stoicism, our toughness that we can really be proud of, doesn't turn into not asking for help, right? So we can hold on to these values, but we want to make sure it's steering us in the direction that we want to go. Well, I wonder what slide this was going to be. Let's see. Okay. So when I also think about, when I think about reframing, part of reframing is also recognizing what narratives or messages got given to us, right? Or that we're holding on to. And sometimes our unconscious self-talk can be something like, I'm not qualified to be here, I'm failing, I can't talk to anyone, they won't understand. So like understanding what narratives are often playing underneath the surface. But even, we can even get narratives that are passed down to us, right? I often think about when people say like, our family doesn't do therapy, like we don't do therapy, that's not for us. Or the one that I hear a lot, which is, these are first world problems, kind of minimizing. That one really gets under my craw, right? These are first world problems. Everybody's allowed their frustrations and pain, right? You don't have to stay there, but you're allowed to name it, right? Without feeling like you have to minimize or dismiss it. Or even what's past is in the past. So again, recognizing painful and unhelpful narratives, recognizing unhelpful thoughts and thinking patterns, so then you're able to kind of stop them in their tracks. And part of the ways in which we do, and I think Rebecca gave us a lot of tools for that, right? So one of the ways that, if you've ever heard of cognitive diffusion, it's a technique that I really like, and people often kind of give me the side eye when I think about it. But if you look up cognitive diffusion, it's naming sometimes those unhelpful thoughts. So when you hear them happen, I read an article that said that the author of the article named their anxiety or named their critical thoughts Clive. And so whenever Clive showed up, they would just be like, oh no, Clive, you're not invited to this party. Like, go sit over there. Clive, we're not doing that today. I've got to knock this presentation out. Sit right there. I see you, right? And there's something about getting distance, right? So it might sound funny, but try it. It can be fun. So the third way in, when we're thinking about self-regulating, reframing, and really continuing to experience joy and minimize the distress that we're feeling, it's focusing on values-driven life, living a values-driven life. And the example that I like to use is if you think about being in a car ride, and there's two people in the back of the car. And so Rebecca had the image of the man and the dog, right? I like the image of two people in the car. And one person is going, are we there yet? Are we there yet? Are we there yet? And the other person's saying, oh, well, look at that. Like there's a license plate I've never seen, or that sunset looks gorgeous, or oh my gosh, that's almost a full moon, right? The second person is noticing and is much more comfortable. And I think when we think about being which person you'd rather be the person that's noticing all the pretty things. And if you're thinking about who you'd rather be in the car with, you'd probably rather be in the car with the second person too. But even if the person never, even if the, like, so say they're going to a theme park and the theme park is closed, right? The second person in the back that was noticing all the pretty things will still say, this journey gave me some pleasure, because they were able to notice the things on the way. Whereas for the first person, the whole journey was about the destination. And so when you live in alignment with your values, right, you're able to take stock, and it's not about the destination, right? It's not about what happens at the destination. Sure, you'll be disappointed, but you'll have the buffer of the pleasures that you allowed yourself to experience. And so I'll read these in case you can't see them, but values are your personal compass. They're unique to you. They're freely chosen. They're somewhat stable. Although they can change as you live life. They also guide your choices and your decisions, your direction, right? So your values are not where you're going. Your values are how you get there, and the choices and the decisions about how you get there. And I think that's where a lot of our distress comes from, because we think that we're acting out of alignment, and sometimes we are, with our values to get to someplace we think we should be, when we should focus on living in alignment with our values, and and being a little bit more flexible about where that takes us. Because our hope is that we're going to have a sunny kind of trip, right? But our reality at times is that there are storms, there are challenges that we face along the way. I often think about, if you think about a boat, right? This comes out of Harris's acceptance and commitment therapy. If you think about a boat and a storm comes in, well, when a storm rolls in and there are boats at port, I'm obviously not a sea person, right? I might not be using words correctly, but the boats will drop anchor, and the boats drop anchor not because it does anything about whether the storm is going to hit or not, but because it keeps the boats upright and steady, right? And so when we think about using any of these tools that I've talked about or Rebecca's talked about, it's not about fixing the storm, right? But it's about dropping anchor so that we can weather it. Right. And when we take our intentions off of trying to fix the storm, it can ease some of the distress in our expectations in a way. So the last thing that I'd like to just invite you to do is an exercise on values. And so I'm going to read kind of a guided imagery, something for you to think about. And I'm going to invite you to either close your eyes if that feels safe to you, or just lower your eyelids and look at something, focus on something on the floor in front of you. And we're going to connect to things that you care about most. And sometimes when we think about the things that we care about most, it can cause some difficult feelings or even pain, and that's okay. Perhaps there's sadness, loss, anger, injustice, and you can just pay attention to that. And even mind wandering is normal. But I'll just invite you to pay attention to what shows up for you, both the big splashes when you think about things immediately, and also the softer ripples, the thoughts and the images that come up that are maybe quieter. So in a comfortable position, so getting yourself into a comfortable position, plant your feet on the ground and rooting yourself and grounding. Take a few deep breaths, getting grounded and present in this moment. Making contact with whatever is present in this moment. Any sensations, emotions, thought. And take a few deep breaths, gently bringing the wandering mind to the cadence of your breath. The inhale and exhale without judgment. Cultivating a connection to the present and to awareness of the present. And then asking yourself these questions. In this moment, what is it that's showing up for you in terms of the things that matter most? Paying attention not only to the immediate response, the initial splash, but also the ripple. What rises to the surface in terms of your values, your priorities, just noticing, listening to that inner wisdom. It may be taking care of others, caring for your family, for yourself, giving back to your community, being of service, and just noticing, listening to that inner wisdom. What is it that's showing up for you right now? What matters most? No right or wrong answers. Just noticing what comes up for you. And perhaps asking yourself, what actions can you engage in? How can you live out these values, whatever they might be? During this time, what does it look like for you? How can you start to live out these values? What kinds of commitments can you make? What kinds of intentions can you set to live out these values during these challenging times? How would you like to look back on yourself during this time? What would you like to see yourself having done? Allowing yourself to reflect on these questions and seeing what comes up that you can solidify. And then when you're ready, opening your eyes and coming back to this moment right here. And jot down some notes to yourself about what came up. Knowing and holding the knowledge that there's an opportunity each day to live out these values that you've chosen for yourself. And as you're jotting these notes down, if there's any that you want to share into the chat, into the questions box for the organizers, we can read them out. I want to be mindful of time, and so I'm going to be kind of selective about which slides I go through next, continuing to invite you to jot down your thoughts about what came up along that exercise on values. We might not be able to live our values in the ways that we prefer, but extending compassion to yourself to that reality. Consider ways to sprinkle these throughout your day. Connect with valued actions and choices anyway, no matter the emotion. There's no good or bad emotions. Sometimes there's really intense and big emotions, but they're not good or bad. They're all purposeful. So one thing that I'd like to leave you with, because I want to make sure to leave time for any questions, is that one way that you can take committed action based on your values is to practice a promise to yourself. And you can send yourself an email, a text, a promise that guides your intentions for that moment, that day, that week. And if you can, we text ourselves sometimes reminders all the time. Text yourself a promise. And it acts as a reminder that regardless of the challenge or obstacle, you're acting within your values, or you're setting the intention to. I promise to live, to work, to continue on, to love, to be, to become, to believe, to promote, to strive, to seek. And we don't really have a way to share out, but maybe just with your heart and with your intentions, just share out right now. And hopefully everybody that's listening can know that they're receiving your promise that you're sending out into this virtual platform. So I'll end there. I have two quotes that I love. There's no greater agony than bearing an untold story inside of you. And then this one from Mr. Rogers, whose birthday is coming up in February. Anything that's human is mentionable, and anything that's mentionable can be more manageable. When we can talk about our feelings, they become less overwhelming, less upsetting, and less scary. The people we trust with that important talk can help us know that we are not alone. And you're not alone, and we're not alone. And thank you so much for sharing this time with us.
Thank you so much, Rebecca and Candace. This was definitely not your regular old burnout talk. While we give everyone a chance to ask any, type in any questions that may have come to mind over the last hour, one did come through about why only doing the 4-7-8 breathing twice a day? Can we do it more than that if we really want to?
Well, I think the idea is to not over kind of stimulate your breathing, especially if you're just getting into, because I don't know if this was the first time you tried it, sometimes people are like, I got really anxious holding my breath for that long, or I really overthought it. And I think the idea is that it's a practice. And so he just encourages you to start really slow and moderate, because the idea is to do it twice a day on an ongoing basis. And I think if you're doing it 5 or 6 times a day, can you really do that every day for a week? So the idea is coming up with a cadence that can be manageable, so that you can do it on an ongoing basis. I don't think it's going to hurt you to do it more often, but if you think about, the point is to incorporate it into your day-to-day, it's more manageable to think about twice a day.
Yeah, I have to say, as I was doing it along with you, I was like, oh gosh, that's a long time to hold my breath and a long time to exhale. So I can see that overstimulation being part of it as we're first starting to practice those. I loved, thank you, by the way, for things that were sort of portable and actionable in quiet moments, or even when you're in the OR in a stressful situation, right? Dropping anchor is certainly something you could do in just a few seconds during some stressful moments. Any questions?
Yeah, and even as a metaphor,
yeah,
the idea of dropping anchor, just to come up with that image.
Yeah, it was fantastic. Well, we've either relaxed everyone into a state of well-being bliss, where everyone is practicing all of their well-being techniques at the moment. Nothing has popped up, but I want to thank you and Rebecca very, very much for being here. I think we all took away some really tangible, easy things to take with us. And in a world of surgeons who aren't always the best at talking about our feelings and sharing our stresses and our struggles with each other, I think I certainly feel like we have a little bit of permission to do that with more ease.
Thank you so much. And I really enjoyed Candace's session a lot. I actually learned quite a few things that I plan to implement. So thank you for letting me be part of this.
Well, Ken, I'll pass it to you to close out.
Thank you. Thank you all. This was wonderful. And I'm glad I was able to be involved in this. I thank all the speakers. Thank you all for the attendees for paying attention and staying hopefully somewhat engaged. I hope it was helpful for you all. And everybody have a very good night. And Odian, do you have anything else you want to add?
Not at all, thank you. And I hope that this will be shared with our members who couldn't make it onto the call.
That'd be great. Yeah. Great.
Thank
Thank
you.
you all.
Good night.